I am so excited to speak to our guest today. He's a double board certified facial plastic surgeon all the way out of Beverly Hills. Please help me to introduce Dr. Sedgh.
Hey, Jonathan, thanks for having me on the show. Looking forward to talk to your audience about what I like to do.
Yes, and I'm excited to have you on the show. I have so many questions, so let's get right into it.
Hi, my name is Jonathan McLean, and I'm the founder and CEO of McLean Aesthetics.
Welcome to the dark side.
Let's go. So Dr. Sedgh, let's start from the beginning. Let's rewind a little bit. What made you want to pick plastics as your residency?
Sure. So it was a long road and route to get here. As far as the residency, I knew I wanted to do some kind of surgery. It was hard to narrow it down to exactly what specialty or subspecialty of surgery. Mm-hmm. So I decided to go into head and neck surgery because it was fascinating, and at the same time it had a diverse route to different subspecialties, such as facial plastics and reconstructive as one of them, or you could do head and neck cancer, for example, as one of them, or sinus surgery. So basically at that point I wasn't sure exactly what will be the subspecialty that I will be going into. So I liked, I was fascinated by head and neck surgery and the more delicate type of surgery and the more complicated anatomy. So that's how I got started. And once I was in head and neck surgery, and we were doing rotations and trainings in different subspecialties, then gradually I kind of found myself more and more interested in facial plastics and reconstructive. It was both the cosmetic and reconstructive aspect of it that was kind of fascinating, and I felt, okay, this is what I want to be doing.
Mm-hmm. So tell us a little bit about what you specialize in currently.
Mm-hmm. So I'm a facial plastics and reconstructive surgeon. So I have my specialty training in head and neck surgery, and then I did an extra year just focusing on both cosmetic and reconstructive surgeries on face and neck. I have, in the first couple of years, I was doing more reconstructive type of cases, and then gradually my focus was shifted to mostly cosmetic surgery these days. As far as a niche, rhinoplasty and revision rhinoplasty is at the moment more than half of my caseload, and that's really my niche. And revision rhinoplasty, I always tell people that's my favorite surgery.
Are you still seeing like the buccal fat trend?
Yeah, buccal fat, it's an interesting trend. Actually it wasn't as buccal fat is an interesting surgery. It was popular for a while, a long time ago, and then it fell off the track, and then it was reintroduced over the last decade. And it's a controversial topic. I have seen some surgeons who absolutely disfavored or are against this surgery, and I know some surgeons who routinely perform it on their patients with a high volume of buccal fat cases. I think my position on it is somewhere in between. I think it's a good surgery for the right candidates. People need to know it's a pretty simple surgery. It's pretty low risk once someone has mastery of the anatomy of the face and has proper training to do the surgery right. But there are some downsides to it. Once you remove the buccal fat, obviously it's not going to come back. And as we age, we're going to lose some of the fatty content of the face. So patients who's undergoing buccal fat reduction needs to know that naturally in the next couple of decades, they're going to have a thinner or more hollow mid-cheek area just by process of aging. So if they already have a pretty chubby cheeks, and understanding that this is going to get thinner down the road. As long as they are okay with it, I think it's a great surgery, and many patients are okay with it, because once you're in your 20s and you don't have like that contour and you get a nice chiseled look, I think it's worthwhile for a lot of people to go all the way to 40s and 50s and then have maybe too much hollowing at that point, maybe not. And then there's always things that can be done easily, such as fillers or fat grafting, to add to the contour if need be.
Yes, for sure, for sure. With the semaglutide out in the market, I hear a lot about like Ozempic face. Kind of, what are your thoughts on that?
You know, that is something, it's not really my area of expertise. That's more endocrinology and metabolic. I have read about it. I'm kind of from the periphery following it. I'm guarded about something that can have a drastic effect metabolically. So I always tell people they need to follow with their medical doctors on that. I don't think this is a plastic surgeon's area of expertise. I'm kind of like interested in getting more information about it and then just see the pros and cons of this medication down the road.
Okay, no, for sure, for sure, for sure. Now, with plastic surgery becoming so popularized, everybody's trying it nowadays. What are some tips for like a regular day person that's looking to get plastic surgery, things they can do to see if they might be a good candidate for it?
You know, the most important thing is what the patient sees in the mirror and what impression of their aging process or their natural anatomy they have. They should not be following trends. They should not be seeking plastic surgery because plastic surgery is popular. It should be based on something that I always want to see, that this is not an impulsive decision. You know, patients, for example, come in for otoplasty for prominent ears. A lot of times I'm like, you know, for how long has this been bothering you? And a lot of times it goes back to their elementary school when they were kids. They're like, since then I was unhappy with my ears sticking out. So that's a good candidate because it's a lifelong, you know, thought process that's been bothering him. The second thing is, if it's something really anatomically is unfavorable and we can improve. If somebody comes in with pretty good looking nose and they want to just tweak it slightly, I always tell them, you got to think about it. Maybe it's an exam that you've got an A-. It's a tough exam. Would you be willing to totally retake the exam? Or would you just let go of it if it's an A-? That's a good analogy for people sometimes to think about some complicated plastic surgery that they're contemplating.
Yeah. For sure, for sure. No, I agree. I agree 100%. 100%. Now, being a surgeon nowadays, you have to market yourself so much. How do you kind of keep up with that? Like, how do you keep yourself still relevant around, you know, people to keep coming to you?
Right. You know, yeah, the times are changing as far as how people get to know you. I think there are multiple modalities, and it's a combination of them that will bring patients to your practice. Still, I think the most reliable source of patient referral is other happy patients. You know, people's friends and family are still the most trustworthy and reliable source of referral. Colleagues and doctors are, again, another reliable source of referral. When it comes to marketing avenues, more and more I found social media to be a relevant factor. I was personally one of the people who wasn't actually as active on social media early on. And as time's gone by, I got more interested in it. And I find a lot of my patients actually get a lot of their information from social media. There are pros and cons with social media. The pros are that it's a visual platform, so you do actually see a lot of relevant things that you want to see. And you it kind of tailors towards the stuff that you're interested in. So for patients, it can give them quite a bit of information in an effective way. However, as far as its cons, I would say it makes it a little bit more difficult for patients to have distinctions and measures about things because it's not regulated. It's not an academic platform. So it makes it a little bit more difficult for patients sometimes to be able to ascertain what's the reality and truth and what's a myth or what's just somebody's opinion.
Mm-hmm. Yeah, I agree with that. And I always also say, like, you know, back the information up. So get the, you might find the surgeon that you're looking for on Instagram, but then go into the medical board and do more research to see if that surgeon is the right fit for you.
Exactly. I think social media, it's helpful to get you that exposure, and vice versa for the patients, to kind of like see who's around and what they're doing. But I always tell my patients when they ask how they should use social media in their decision making, and I tell them we live in a subspecialized world. In plastic surgery, it's a very subspecialized world. There's almost no plastic surgeon who does all plastic surgeries, even in cosmetic surgeries. Yeah. So you gotta really see from the social media account, you gotta just get a sense of, okay, what are the surgeries that particular surgeon is particularly focused on, and also credentials, as you mentioned. You want to go to someone who does have proper credentials in the field. That is not sufficient, but that's necessary, in my opinion, because you can have credentials again, but you might not be focused on that particular surgery. And my patients sometimes ask me about breast surgery questions, and I'm like, that's really not my area of expertise. So that's something that I wouldn't, I'm not even qualified to give any detailed advice on it. So you guys just follow, use the social media, go do that, see the credentials, go to the website, look at the before and afters, look at complicated cases that surgeon does. That's really what distinguishes a higher quality of work, whether you do complicated revisions, whether in general, you do a good number of revisions, whether there's a big before and after album about that particular surgery. And also see the online reviews. I think the online reviews are an important factor. It's not everything. Not every native review is really a representation of a bad practice or a bad surgeon, and not every single good one is necessarily, or just the number of reviews necessarily are a distinguishing factor. But you can get a sense from the online reviews about the whole nature of the practice.
Do you think sometimes like a lot of bad reviews come from not setting like like the patient not having a good expectation of what's happening next?
It plays a role, definitely. In plastic surgery, patient selection is important the same way as surgeon selection is important. It's got to really be a match. And patient selection, when it comes to patient selection, you got to again see back to that question: why is a patient seeking this particular surgery? Number one, is the anatomy, is that area of the face, for example, relevant to my work? Has it really been undergone enough aging process, or anatomically or genetically was it unfavorable to begin with, that patient's a candidate or not? And what are the risk-benefit ratios for improvement? And my line of work, rhinoplasty, if patient seeks perfection, he or she's not candidate for rhinoplasty, because rhinoplasty is not a surgery of perfection. I tell patients there's always going to be some differences between the two sides of the nose, little asymmetries. We call them human asymmetry. We are not robots. We are asymmetric faces. So if somebody is not okay with that, then they should not be seeking plastic surgery. So expectation is, managing expectation and having the right attitude towards it is important. But at the same time, it's surgeon's responsibility too to be able to deliver a solid improvement for the type of surgery that patient was seeking for. If you see gross asymmetry in the results, if you see an obvious unfavorable outcome, then surgeon should be able to have backup options and touch-up or revision modalities available for the patient to improve the result of that suboptimal or original results.
Yes.
So both of them, I think, play a role.
Awesome, awesome. Now, I do recruiting for surgeons also, and one of the number one questions that I get asked is, especially for the younger surgeons, they always ask me, well, I want to start my own practice, but I don't have the clientele. Should I go work for somebody? What should I do? So I would love if you can give some advice on that.
That's there are different ways to go about that. But in general, I would say you need to get good experience before you can be trusted. So in surgical world, in cosmetic surgery world, a lot of our residency cases are not particularly tailored into gaining firsthand experience in cosmetic surgery. So even when we are trained at top tier institutions, by the time we finish residency and fellowship, we have a good foundation and surgical skills overall, most of us. But when it comes to experience in cosmetic surgery, it's usually not enough. For example, for most of us, after 5 years being in practice, there's definitely a jump level as far as confidence and improvement in quality of the results. So I would say, yeah, gaining that experience, whether through joining a bigger group, a community practice, some sort of higher volume practice that you can do more simple cases and work your way up towards more challenging cases and getting comfortable, making it more of a second nature.
Wow, that's great. That's great advice. That's great advice. And when should they go into it, when should they start bringing on patients of their own? When should they be able to build their own practice, or when should that happen?
A lot of times, again, it all depends on the individual case and their comfort level. But a lot of times, as you go along again with that type of practice, you will find your own comfort level. And again, depending on the complexity of the case and your background experience with that type of surgery, you know that as you're getting comfortable with that type of surgery.
Nice. What are some conferences or some trainings that surgeons can go to really you feel are one of the best in the industry?
So there are a lot of good conferences. I like to mix them up a little bit to just get new exposure with at different conferences. I think it's not just a matter of which conference to go. I think it's a matter of being active and joining and participating in these conferences on a routine basis. COVID was a little bit of a hiccup, so I gave it a pause, which made me appreciate it more actually when these conferences are around. But before COVID and post-COVID, usually I participate at least 2 or 3 conferences a year. Some of them are closer to me, more in California based, or Las Vegas has a good cosmetic surgery conference that I've been going for many years. And then some are multi-specialty ones that I particularly like, because then you get exposed not only to facial plastic surgeons, but also to general plastic surgeons, oculoplastic surgeons, dermatologists. So you get more of a global exposure to what's new and what's relevant to your field.
Why is that global exposure so important?
Because we all come from different backgrounds, and by nature of that, we have weaknesses and strengths. So nobody knows it all, and based on even people in the same subspecialty, again, as we talked about, some people have more focus, and they're more focused on one procedure versus another. So being exposed to that multi-specialty approach and experience, really, it kind of fills in some of the gaps in your knowledge and experience. And that allows you to be more in contact with those people that you can trust their judgment. And, just makes you evolve in your field faster.
Definitely. What are some tips that have longevity in your career?
I think as far as longevity is concerned, the key to longevity is consistency and patient experience. For longevity, in order to be good at something and continue to be relevant, you want to be consistent. So you want to make sure that, as we talked about going to these conferences, always honing on your skills and making sure that you stay up to date to bring that consistency. And as far as the patient experience, this is all about patient experience. It's all about what patients want, what's achievable for them, and how the surgery and the result of the surgery and the whole journey make them feel about themselves and this particular surgery that they were interested in. So being authentic, and again, being confident of delivering the results that they are seeking, being confident that you can deliver it, and if you know the expectations is right, they are the right candidates, and you can deliver it, I think is key to maintain a happy patient population, which will keep your practice flourishing.
Amazing, amazing advice. My last question is, who are some key opinion leaders in this industry that you can recommend for the audience to follow and learn more?
Sure. So again, in facial plastics, for each procedure, you gotta go to a particular niche of surgeons. My line of expertise, which is rhinoplasty and revision rhinoplasty, has a lot of experts around the world that, again, with different philosophies, different approaches. They bring just newer techniques and new understanding of concepts into the field. Particularly, one of the people has inspired me, and I followed a lot of ways and of him thinking about the nose, and he's come up with some of the newer techniques in modern rhinoplasty. Is Dr. Toyomi in Chicago. He's an academic surgeon with pretty long-standing resume and experience, very focused on rhinoplasty and revision rhinoplasty. And yeah, he is one of the people that I would recommend following.
Great, great. Well, thank you, Dr. Sedgh, for sitting down with me, speaking more about plastic surgery. Tell everybody where they can find you.
So we are right at the border of West Hollywood and Beverly Hills, actually, Sunset Plaza in Los Angeles. So we are at the 9201 Sunset Boulevard, which is called Sunset Towers. We only have one clinic. It's a boutique practice. We get to know our patients well, and they get to know us well. So we would love to, see whoever is interested in both cosmetic and reconstructive focused facial plastic surgery.
Awesome, awesome. And until next time, bye.
Awesome. Take care. Good to be with you, Jonathan.